You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Welcome back to the Mother to Baby podcast. My name is Chris Stallman, and if you're tuning in for the first time, or even if you're a frequent listener, just a reminder that Mother to Baby is a nonprofit organization that gives information to patients and their healthcare providers about exposures during pregnancy, breastfeeding, before pregnancy, and for potential adoptive parents. And an exposure is something that you can come in contact with in pregnancy or breastfeeding, or of course before pregnancy. So things like hair dye, nail polish, viruses, medications, they all count as exposures. And so if you do have any questions for us, I encourage you to contact Mother to Baby. And as you may know, there's a lot of different ways you can do that. Of course, you can always listen to us here at the podcast. And if you have a question for the podcast or want to be on the show, you can contact us by email at contactus@mothertobaby.org. Of course, you can always call us. You can text us. We have a live chatting service, and we have a website, mothertobaby.org. And if you were with us last time, you know that we were talking about the Zika virus during pregnancy, something that we don't really hear a lot about in the news, but still is something that we are concerned about and thinking about. Because if a woman does contract the Zika virus during pregnancy, there is a chance that there could be some consequences for her baby. So like birth defects. And to talk more about this topic, we have our return guests from last time. We have Lorrie Harris-Sagaribay from Mother to Baby North Carolina and Kirstie Perrotta from Mother to Baby California. How are you ladies doing today?
Great. Thanks, Chris. Thanks for having us back.
Oh, our pleasure. I know that there are lots of questions that not just the three of us, but all of our Mother to Baby teratogen information specialists get. And just as a reminder, a teratogen information specialist is someone who is trained to give good information, reliable scientific data about exposures during pregnancy and breastfeeding. Like I said before, we're just going to go right back into the Zika virus. So yeah, this is important all year long, but we're actually right on the brink of holiday travel season. You know, in some places in the US and other places too, it gets really cold and people are so interested in a little bit of warmth, a little bit of sunshine, maybe some beach time during their pregnancy or when they're planning a pregnancy or even during breastfeeding. And so this question does come up over and over again. We get it through email, chat, texting. Lorrie, I know that you do chatting and texting as well as phone calls. And Kirstie, I know that you do chat as well as phone. Are you still getting these questions about Zika?
Yes, absolutely. It's still a very hot topic, and we get questions about it on a daily basis. Just this morning, actually, I was on our live chat, which you can access via mothertobaby.org. And I was chatting with a woman who just found out she's pregnant. She's about 6 weeks along, and her sister is actually getting married next month in Brazil, and she already has her flight booked and her hotel booked, and she wanted to know, is it safe for her to travel there now that she's pregnant?
Oh, what a good question. And what a tough thing to have to think about while you're so early in the pregnancy. So how did that go? What information were you able to give her?
Yeah, it's definitely tough. I mean, we hear from people that have to travel for funerals and weddings and serious work trips that are really difficult to get out of. But again, because the repercussions of being infected with Zika during pregnancy are so severe, it's definitely something that we want to talk about and make sure she's aware of those possible risks. So basically what I told her is that Brazil is currently defined as a purple country on the CDC map. And if you listen to the last episode, you heard Lorrie define what a purple country is. It's somewhere that has either current or past transmission of Zika virus.
But no current outbreak, is that right, for purple countries?
That's right. So purple countries are not an area where there's a current outbreak. But like Lorrie explained, possibility of low-level transmission still occurring. So what we have to tell people that are traveling to a purple country during pregnancy is that if you choose to travel there, you would be accepting some level of risk. Again, it's really hard to quantify how high that risk is, But if you are bitten by a mosquito that happens to be carrying the Zika virus, which we still think is happening at low levels in these countries, there is a possibility that you would be infected. So the safest approach for this woman would be to not attend the wedding, which again, I know is a really tough decision for her to have to make. So one more thing I want to mention that I told this woman who had chatted with us is the importance of thinking about her partner. So she had told us that her husband was planning to attend the wedding in Brazil as well. And we had already talked to her about, the safest approach during pregnancy for her would be to not travel. But what about the husband? What if he still wanted to attend the wedding? That question definitely comes up from time to time. And for men, traveling to a purple country, it really is the same idea. If they're traveling there, there is the possibility that they could be infected with Zika if they're bitten by a mosquito. So in that case, it's really important to address the importance of safe sex for the duration of the pregnancy. CDC has guidelines on this, and they say that if a man travels to a country where there's a possibility of Zika infection, that when he returns home, he should be using condoms or abstaining from intercourse for the duration of the pregnancy. So even though she's very early on, she's just 6 weeks along, their recommendation is very strong here. They do not want to have any possibility that he could infect her from unprotected sex, because we know that the virus can linger in the semen for some time. So again, condoms or abstinence would be the best approach for her partner.
These questions are so difficult to answer. And I know that you ladies know this firsthand, how hard it is to counsel on these types of questions, because the US on this map is in that purple area as well.
That's a great point, Chris. And we actually get a lot of questions about why the U.S. is also purple. And the reason is because it falls into that same category of being a country where there have been cases of locally acquired Zika in the past. And when we say locally acquired, again, we're talking about cases that where people became infected by a bite from an infected mosquito. And so we have had cases in both Florida and Texas in the past, but we haven't had cases of locally acquired Zika in the United States since 2017. And we know that if there are any new cases here in the U.S., that we would know about that very quickly, and we would know exactly where those cases were. But in other countries, it's difficult to get reliable data for every country around the world. That kind of data just doesn't exist. A lot of the resources that helped countries in the past collect information and report cases about Zika, those funds have been dedicated to other more pressing health issues. And so the level of risk within a purple country could change without us knowing about it right away. And so that's sort of the difference between the United States being purple and other places outside of the United States being purple.
Okay, so thinking about a woman and her partner, what happens when they're not pregnant, when they go on the trip, but they come back? So let's say they go somewhere that's considered to be a purple country. There was either current or past transmission there, no current outbreak. How long do they need to wait after coming back home before they try and get pregnant?
Great question, Chris. And again, it's funny, everything you bring up, we have a question that we've gotten. This one came in to me through email the other day. My partner and I just got back from a trip to the Dominican Republic, and we want to know how long we need to wait before becoming pregnant. So the recommendations here are clear. If a couple has returned from a place that has a possible risk of becoming infected with Zika virus, and so again, that could be purple or red places on the CDC's map, there are a couple of things that they should do. One is, while they're there, they should take steps to prevent mosquito bites. They can use insect repellent, wear long sleeves, long pants, cover the skin to minimize the chance of getting bitten by a mosquito. When they get back, the recommendation is that they postpone getting pregnant for a certain period of time. So if only a woman travels, that wait period before she tries to get pregnant is 2 months. And that should be enough time for the virus to be cleared from her body before she tries to get pregnant. But if a man travels, then that wait time is 3 months. And so in this case of this couple who had emailed me, I recommended to them the CDC recommendation is to wait 3 months before they start trying to get pregnant. And the wait time is longer for men because, as Kirstie mentioned, the virus can stay in the semen for longer than it can stay in other body fluids. So based on the research, it's suggested that waiting 3 months should be long enough for the virus to be gone from the man's body. So that's the first part of that recommendation, is to postpone pregnancy for 3 months. The second part of the recommendation is that during that wait time, they should use condoms. And the reason for that is to prevent either of them from passing the virus to the other one. This is something that's more commonly passed from a man to his partner than from a woman to her partner. But if they use condoms during that time, then they avoid the chance of him passing the virus to her. And then, of course, once the virus is gone from both of their bodies, then it no longer increases any risk to any future pregnancies.
And speaking of partners, one thing that we get a lot in Arizona is me or my partner have been somewhere, and now there's some questions about testing. So one in particular that we received on the phones was, I'm pregnant and my husband just got back from a bachelor party in Thailand. Can he be tested to see if he has Zika?
Yeah, so I talked to this woman on the phone today, and it's a great question, and it comes up all the time. I mean, wouldn't it be great if we could just have a simple blood test that gave us 100% definitive yes or no answer? But unfortunately, that's not the case. So at this time, CDC does only recommend testing people with symptoms of Zika virus. So that would be things like fever, rash, red eyes, joint pain. If you have any of those symptoms and you've traveled to an area where Zika could be circulating, definitely chat with your doctor. For pregnant women, though, or people that are planning pregnancy, men that are interested in planning a pregnancy, there's no recommendation for them to be tested if they're asymptomatic, if they don't have symptoms. So for her partner, what I said is, sometimes men can find a way to be tested, even though it's not recommended. But that doesn't give us the full picture. Even if he found a way to have his blood tested, the virus can leave the blood pretty quickly. But again, like we've mentioned a couple times, the concern is that it can stay in the semen for some time. And we just don't have a great way of testing the semen right now.
Yeah, so based on everything that Kirstie just said, even if he were to be tested, it wouldn't change the fact that they would need to use condoms for the rest of the pregnancy after he gets back from the bachelor party in Thailand. If he had a positive test result, then of course we would know he had the virus and he would need to use condoms to protect that pregnancy. But if he has a negative test result, that doesn't necessarily mean that he doesn't have the virus. There are some limitations. So going through that process of being tested really isn't going to provide us with useful information.
And all this information, including links to the CDC recommendations, the map, other information about Zika, can be located on our MotherToBaby website. In fact, we have a whole dedicated area in our Hot Topics section called Zika Central. And all of this information and more is there for the public to access, again, free to anyone who had additional questions or just wanted to look up some of the information that we referred to today. So another information-packed episode. Kirstie, Lorrie, thank you so much for your expertise. Before we sign off, is there anything else critical that you think that our listeners should know about?
I'd just like to remind people that having symptoms is not necessarily an indication that you have Zika virus. Only about 1 out of every 5 people who have the virus will actually have symptoms. So for couples who are pregnant or couples who are planning a pregnancy, it's really important that they follow these recommendations from the CDC, even if they don't imagine that they've been infected.
Yeah, that's definitely a great point, Lorrie. I'm really glad you brought that up. And my final thought is just, if you have any questions about this virus, definitely don't hesitate to contact MotherToBaby. It's confusing, the recommendations change over time, and there's a lot to keep track of in regards to Zika virus.
Kirstie, I think that that's a really good point. We do have a lot of different ways that you can get to MotherToBaby. We do have the email feature, and we also have a text feature. So through texting, you can find us at 855-999-3525. You can use the handy dandy phone line at 866-626-6847. You can also visit us at mothertobaby.org. And again, our website does have Zika Central, but you can also access our live chat feature there as well. So if you want to ask your question that way, then please feel free. So to wrap it up, ladies, again, thank you so much for your time and your expertise. And so this is Chris Stallman signing off, saying thank you to everyone who is listening to this podcast. We hope that you're going to listen again in the future. You can find us on iTunes, Spotify, or however you listen to podcasts. We would encourage you to subscribe so that way you never miss a new episode. And of course, you can go back and see some of our previous episodes as well. So thank you. And if you have a question or want to be on the podcast, feel free to email us at contactus@mothertobaby.org. Remember, MotherToBaby's here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.